Hi everybody. The idea of this session is that this is called a Patients' Day. We've done a tremendous amount of listening to national experts in the field, and this gives an opportunity for patients to talk about things that concern them. And we thought we'd kick it off just by simply having a group of patients, myself included, who are going to spend a couple of minutes each just telling their story, and then throw the meeting open to throw the discussion open to the room. John reminded me to tell you that when we break for coffee after this, the clinicians and the scientists are still going to be here. Okay, so please feel free to buttonhole them out there in the coffee. As questions you want them to answer, please ask. And if there are any questions you want to bring up, if you want to talk about issues about your life and your story, the way in which the disease impacted on you or hasn't impacted on you, then I think we'll do that in the general discussion. Any questions? We're not experts. We're just patients, same as you are. But we can maybe field some of the questions towards some of the experts. My name's Phil Smith. I was diagnosed with IgA nephropathy 8 years ago. And I was picked up in a general call-out from my GP surgery. I was 55 at the time, and he called people together of that age to have a general health check. And I went in. I felt that I was perfectly healthy, although I was working in a very high-stress job. But, I mean, I was okay. And it was found that I got very high blood pressure. And there really seemed to be no reason for that, other than the fact that I was working hard. And that was followed up with a blood test. And that blood test showed that I'd got impaired renal function. And my renal function was down to about 25%. I then was sent to the hospital where John works for a renal biopsy. And the renal biopsy showed that I'd got IgA nephropathy. And that, my condition, my renal function deteriorated at about 1.5% a year, up till last Christmas. And at last Christmas, the consultant who I work with at the hospital, Graham, said, well, you're down to 15% now. You better go on the transplant list. Now, it was quite interesting for me because I'm one of the lucky ones, really. I'm what's called asymptomatic. I had absolutely no symptoms whatsoever through the entire course of this. Even when my renal function dropped to 15%, I was going to the gym 3 times a week. I was having no side effects at all. I was doing the things that they told me about, moderating my diet, and I had a problem with potassium, so I had to eat low potassium stuff all the time. I went on the transplant list at Christmas, and on the 27th of April, I was in bed early in the morning. I got a telephone call, and I picked the phone up, and they said, "Is that Mr. Smith?" I said, "Yeah." And they said, "How are you feeling today?" And I said, "I'm all right. I feel fine." They said, "No coughs or colds." I said, "Who is this?" And they said, "Oh, it's the general hospital just checking up on you." I said, "No coughs, no colds, no chest infections. No, I haven't had any chest infections. Feeling healthy, yeah, eating well, feeling healthy, feeling perfectly okay." And then the phone was passed over to somebody else, and who said, "Well, and I won't tell you his name, but I'm one of the transplant surgeons at the hospital, and we've got kidney for you if you want to come in." So I said, "Oh, really?" I said, "Can you tell me a little bit more than that?" And he gave me information about the kidney and its function, and although he didn't identify it, a little bit of information about where it had come from. So I packed a bag and went into hospital, and late that night had a kidney transplant. There were a couple of problems I had with it. I had a neckline I'd never had dialysis before, but they needed to take some potassium off, so I had a neckline went in. And that went in a bit wrong. And in fact, the neckline went out of my vein and into my artery, so I had to go to another hospital, have that removed. And I also, a couple of weeks after the transplant, I developed a swelling where my kidney is, which is just here, which they were a bit worried because they thought it might have been a hernia. But it wasn't a hernia, it was a collection of fluid. So I had that fluid taken away, and they've got the fingers crossed because they were hoping it was a type of fluid called serum. And apparently, if it's this fluid called serum, when it's been taken away, it stays away. And mine wasn't. It was fluid called lymph, which they really hoped it wasn't. So it came back again. within the week, it was, you know, I was pregnant again. So I had to go back to hospital, and I had to have some keyhole surgery, and they put a drain in between where the fluid was and where into my peritoneum, and it drained away that way. And since then, it's been fine. The only impact I've had really, as I said earlier when we were talking about fitness, is how you go backwards in your fitness after a transplant, because you do rest and you don't do as much as you did before. And when you start doing proper exercise, it's like you're starting from the beginning again. But it's getting a lot better now. I can swim a lot better, and I can run now, and I can do resistance stuff. So that's me. I will say one interesting thing. You do have interesting contradictions between the work that happens in the hospital and your GP surgery. Because about a year ago, I was called into the GP. I had a message from the GP. Calling people in for a urine sample. I thought, oh, here we go. So I went in and took a urine sample, and a couple of days later, emergency telephone call. Can you come straight into the surgery? I said, yeah, okay. I've been visiting my consultant 4 times a year. And every time I went, he sent a detailed letter to my GP surgery. So I went into GP surgery, and I saw a locum who said, we're really worried, Mr. Smith. And I said, oh dear, that doesn't sound very good. I said, why is that? She said, you've got protein in your urine. And I said, yeah. She said, well, it's pretty high. And I said, yeah. And she said, well, we need to find out why. I said, well, I've got CKD. I'm a kidney patient. And she said, are you? And I said, yeah. And she said, how long have you been kidney? So eventually we got it sorted out. So there does seem to be a bit of a disjunction in terms of communication between what happens in hospitals and what happens with your GPs. I know they're very busy. Okay, thank you. Margaret, have you got time to do a quick one?
Yeah, okay. Sorry.
Margaret's got to leave to catch
I'm really sorry. I've got to go. So I'll just say very quickly then my story. So I was diagnosed about 5 years ago with IgA, very similar to Phil in the sense that it was picked up just through routine GP's screening, if you like. However, I'm quite sure I had it for many years because I had been treated for high blood pressure for 10, 15 years before that, and it had never been picked up as anything more than that. So I'd just been treated for the blood pressure. So at the time, so I went through loads of tests. It took about a year to get diagnosed with IgAN. Obviously, it finished with a biopsy. In my case, 2 biopsies. We just won't go there. It was just... Anyway, it was picked up eventually. But in that year, my EGFR, my kidneys function, dropped from 65 to 35%. So I was told that quite likely within 6 months I'd be on dialysis because my kidney function was failing rapidly. So my consultant and I decided aggressive treatment was the way forward. So even more blood pressure tablets to take blood pressure down, and onto prednisolone and mycophenolate mofetil. Now, I'm quite aware that this is quite a controversial treatment. I have been on this for 5 years, not always at the same level. I started off with 40 milligrams of prednisolone, which you really don't want to be on for very long. I'm now on 5 a day. But mycophenolates, I built up to, well, it's 4 by 500 a day, and I'm still taking those. Now, I have no idea whether that's the reason why the kidney function leveled out or not. But my kidney function at the moment is round about 25%, so I'm not taking any chances here because I haven't got much to lose. But what's interesting is it's dropped round about 10 points in 5 years, which I suppose is about as good as you can expect for a slowly failing kidney. So whatever the reason, and it may just be the aggressive blood pressure treatment, it has improved in the sense that I'm not on dialysis at the moment and I'm not on the transplant list. I'm sure that's just round the corner, but we just keep going. And I think, in fact, that's what I wanted to say, really, because you can't let it dominate your life. You know, I've got a life and I do all I can. Anything I can, I do. And the rest of the time, I just get on with my life. I take my medication, I do some exercise. I must say, felt a bit guilty during the exercise talk, not quite as much as I should. I play golf, so I do lots of walking. And it's interesting, I just go ahead. But it's changed my approach on life quite significantly, actually, because I sort of think, well, if I can do it now, I'm going to do it now, because I don't know if I'll be able to do it next week, next year. And so it's had a major impact on my life. It was never on my list of things to do to be any type of politician. And somehow I found myself being elected as a local councillor and then as a local county councillor. So life is extremely busy. I haven't got time to think about IgA, and except at my appointment times, when I'm always very nervous when I have blood tests, etc. I just get on with life and do what I can. It does change your life somehow. You know, I mentioned, I think earlier, excuse me, I get very cold. I'm always cold. And also, it's had a very strange effect on alcohol. Or should I say, alcohol now has a very strange effect on me to the extent where I just don't drink it. I'm not saying you shouldn't drink it. I just say, for me, the impact is just ridiculous. So it's just not worth it. So I think my body's it's telling me it's got enough to cope with without that. So I can live without that. That's fine. So if you can do it now, do it now. That's my philosophy. And just look after what you can. Thanks.
Hi everyone, my name's Burke and I'm 20 years old. I was diagnosed with IgA last year in March. The problem first arrived when I was 15 and I'd been to the doctors. I weren't very well, unrelated I think. And she took my blood pressure and it was really high. And she gave me tablets, they always do. And I was really symptomatic for 3 years. I wasn't diagnosed for 3 years after that, till I was 18. I was anemic, low vitamin D I had, and the dipstick tests in my urine were showing blood, even though you couldn't see it. And it was like that for 3 years. The high blood pressure was causing really bad migraines. I had to leave my studies twice. I had to leave my job. And in the end, it was just like life was just nowhere for me. And there was a new GP at the surgery one day, and I said to him one time, I was like, I'm fed up of living like this, to be honest. I just want an answer to everything. And he said that he was going to run a normal blood test for me, which I'd had before. And within 2 days later, he rang me up and he said, your kidney function is at 26%, you have to go to the hospital, which I did. And even then, the hospital didn't think I had a kidney problem. They thought it was my... They thought my high blood pressure tablets were causing my kidney levels to like fluctuate. So I was then sent to a proper kidney hospital, which biopsied me and diagnosed me with IgA. And I assumed that my IgA was quite aggressive, I suppose, because within 4 months I was on dialysis. I'd done 4 months of peritoneal dialysis. I didn't do the overnight one. I used to do 3 drains a day, and it was easy, manageable. I used to take my bags with me if I went out, but I used to get drain pain, so I didn't really like that. And 4 months after, so I'd done 4 months of dialysis, and as soon as I started dialysis, I was put on the transplant list, and 4 months after that, I got a kidney. I actually got the call on Boxing Day last year, and I got the actual operation was on the 27th of December. So that's when I got the kidney, but even then, it's had some ups and downs. A third of the kidney died. They don't know why. They think it got damaged, possibly taken it out of the donor or putting it into me. They don't know what one it is, but it's holding its own. so that's good. And I also contracted CMV from the kidney, so I'm on antibiotics for life to stop that coming back because it gave me an inflamed liver. But at the moment, all is good, and it's definitely improved life a lot. I'm back at college now, whereas I couldn't do that before, and I'm doing A-level biology, chemistry and psychology, which is what I always wanted to do, so it's definitely an improvement. Thank you.
Hello, I'm Richard. Like Phil, I'm from the Leicester area. I was diagnosed with IgA nephropathy in December 2013. A few months before that, I'd had an operation for a hernia. I thought it was healing up all right, but I kept noticing that my ankles were swelling up. And I went to the GP, and he told me to go to the hospital straight away. I had a few blood tests, urine tests, and so my diagnosis was quite quick. From sort of going to hospital, I found out I had IgA nephropathy within a matter of a week or two. When I was diagnosed, I think I had 41% function. A week or so later, we went down to 35, then 30. About a week after that, it was my function dropped away quite quickly. And that year, after I'd had the diagnosis with my symptoms, I was tired. I had very itchy skin. I felt cold all of the time. I used to wake up with hot sweats, which was, that's what I experienced. I think the biggest challenge was more psychological. Everything was very uncertain. I didn't know what was going to happen. My mum, who sat over there, said very early on, she said, you can have my kidney. So I was, I'm immensely grateful for that. But still, you still had the whole process of managing the decline of your kidney function, coming to terms with, previously I'd been a very, very fit person. I'd done a lot of running. When I turned up at my running club to run with them, I could barely run for a couple of minutes because of, I think the anemia made me feel very, very tired. So eventually, December 14, I had a transplant from my mum. Compared to Phil and other stories, the transplant was, relatively straightforward. My recovery was, apart from a few problems with my arteries going into my kidney, it was fairly straightforward. So like I said, that was December 14. I got back to work fine. Ever since then, it's been a lot better from a psychological point of view. If things are stable, you tend not to have the same levels of anxiety. Living with kidney transplant is changed my life. I've managed to have a second child, which is I don't think would have happened without the transplant. And I've taken part in the transplant games, which for someone who was previously sporty, has given me an opportunity to sort of carry on the things that I was doing before. And this year I was lucky enough to qualify for the World Transplant Games, which is taking place next year. So that's me.
Well, you've heard what we've had to say, and I'm sure there are lots of people who want to share some information about the things that have happened to them. I don't know, we're not shooting around with a mic for this, are we? It's going to be too complicated if people are just sort of dropping in and out. What do you think?
It's difficult for people on the Facebook page.
Right.
They can't hear anything unless it's on the mic. So unless you repeat the question, that's another way of doing it. So there are two ways to do it. One is we can shove the mic around, the other is you can repeat the question.
Okay. Well, if it's going to be a quick question, I'll repeat it. And if you're going to be talking at length, you can have this.
So if it's going to be a long question, put your hand up.
Yeah, if you...
Get the microphone.
So in terms of a question or sharing a bit of information about themselves or talking about their story. I mean, who'd like to share with the group some of the things that have happened to them? Thank you.
This is actually a question for the panel from a viewer at home. This viewer was really interested on the impact that your diagnosis had on your spirituality. And I just wondered if any of you guys engaged more spiritually or turned away from it, having been diagnosed with the disease.
In terms of me, no, it didn't. It was, I accepted my diagnosis. I felt fairly positive that my consultant told me that although my EGFR had fallen to 25%, I probably had IgA possibly for decades, and it's taken that long to get that. So I knew that it's probable that this was going to be a slow progression, and it gave me an opportunity to come to terms with it in a reflective way. So in that way, it didn't have any sort of impact upon my view of the world and the universe and all within it.
I'd say my diagnosis did, actually. I suppose before I got ill, I did have a view on spirituality and how the things worked, and then I just found myself really angry or disappointed after diagnosis, because it was, even though I was ill, it was unexpected, and I was just convinced I was going to die, and so it did affect me regarding spirituality. Yeah.
Before I was diagnosed, I was agnostic, atheist, and that's how I remain today. Just the way of the universe, I think.
Anybody like to share any comments from the floor about the way in which their diagnosis impacted upon them? Not necessarily spiritually, but just how you felt about it and how you coped with it, and the impact, maybe the impact on your family as well.
Hello, I'm Brooke's nan, and it does mentally affect on you, because when she goes to an appointment at the hospital, she's in a hell of a state for a couple of days waiting for a phone call. And I'm just wondering, like, anyone else experiences that? Because she's terrible, you know, if anyone else experiences that?
I do, I have me.
Can you have the, can you wait for the mic? Thank you.
I cyclic from being very, very anxious to just forgetting everything and just thinking I'm absolutely normal. And when the consultant says, "Oh, I'm not going to see you for 6 months," I'm like rejoicing that I can just go back into my world of taking my tablets and forgetting about it. And then as that appointment creeps up, I start getting more and more anxious. And then, you know, when it's every month, or I find myself staying in that sort of, I feel like a sick person, and then it sort of trails off again. But yeah, I do get that anxiety.
Hi. So I was diagnosed at the same time, like when, I was 20, so we're your age now. And what I found was really intense at the beginning, and then you really start to live your life a lot more focused, which is actually it's a bit of a, I wouldn't say gift because it's horrible, but you know what I mean. What I struggle with actually is the dips of infection, and if you get a cold and then you sort of have more symptoms, and it's going from feeling really, really sick and then not feeling sick at all, and other people's reactions. So at work, so lots of people come in and they're sick because they don't want to take time off, and I don't know how to deal with that. I don't know how to explain it. I just wanted your opinions on how to explain that to people without seeming really nervy and over the top and like a hypochondriac, I guess, to other people, their perception.
Anybody in the audience like to share a thought about that? How you share information about your condition with others, on the basis that there's a possibility that they could give you an infection. If they sneeze on you, it's not, it's never nice anyway. But if you've got IgA, it's even worse.
Yeah, I guess people don't know what doesn't affect them. So being as open and transparent about your condition and how they might affect that is the best policy, really. And don't be afraid to be blunt. It's your health at the end of the day.
Yeah. In the middle first.
Yep. Yeah. Hi there. I just thought I'd share something with the room, which may be useful to one person. Who knows? I'm a bit like Phil. I've had quite stable IgA for the last 4 years, at about 25%. I live a normal life. I'm quite active. Everything's great. About 4 months ago, I decided to try and lose some weight. So I went on a low-carb diet. For me personally, that was a disaster. My EGFR dropped to 19% and I went into hospital. So just be mindful of that. If you're thinking about a low-carb diet, just watch your EGFR.
Yeah, I was just going to share as well. Similar sort of thing. I found out through just a random, you're of an age, come in, get your tests done, and one of the tests brought up the fact there was blood. And 3 years ago, I finally was diagnosed that I had IgA. In terms of sharing it, I've kept my circle of who knows about it quite tight because I try not to let it sort of rule my life. Yeah. I haven't even told my mother because if she knew about it, it'd be any sniffle or sneeze would be a complete nightmare for her. Or it'd be a nightmare for me, listening to her going, oh, what's going on? And panic. And in terms of, illnesses and being around people, I just came off a cruise last week and somebody described it as a floating Petri dish of disease. And I came off a flight afterwards, which was just as bad. Unfortunately, the real world is you never know when you're going to be in contact with people. So I think worrying about it is possibly not to your benefit. I would suggest if somebody does come in and they're extreme, then you keep well away from them. And if you have the possibility of working from home, then that's great. But the reality is you go in the tube, you go to the store, you don't know what you're facing. So take care of yourself, do everything you can for yourself, but don't worry about it.
Yeah, I just wanted to follow on from the contact at work and things like that. So as a transplant patient, I am the only transplant patient that actually works in the office at Kidney Research UK. So it's part of what I do is also kind of educating everybody else in the office about kidney disease. So the people who come to work for us don't necessarily have experience of kidney disease. And so one of the things I do is do lunch and learn sessions where I basically tell them about the kidney patient journey, and we've got it now as part of the induction. Obviously, for Kidney Research UK, it is much more relevant to do, but it could be something that you try to do at work as part of health and well-being. It could be that you ask if you can run a session and help educate people in understanding what it means, because a transplant is a treatment, it's not a cure. And there's so many misconceptions about kidney disease and about transplantation and about what you can and can't do. And by doing something like that, you could really open people's eyes up, and that might help you in the workplace with the kind of germs and things that go around. I mean, I went into work. We have a shared desk policy now at work. So I went into work, put my stuff down next to my colleague Rosie, and she just looked at me and went, "Don't sit next to me today." And she was literally like, she ended up going home because she was so unwell, but she was able to acknowledge that I shouldn't be sitting near her because having a suppressed immune system could catch something. So I think maybe try and see if there's something that you can do at work about kind of communicating and helping people learn more about kidney disease, And the likelihood is there might be someone there who is affected by kidney disease and you don't know about it. Or there might be somebody there who has something going on and doesn't realise yet. So that's always really helpful as well.
Thank you, Sarah. Just to pick up on a point that Sarah had a moment ago, I was in a meeting once when John Feely, who's the former professor of nephrology from Leicester, was talking to an audience, and he said something that I thought was really quite interesting, and I think it's useful to share with others when you're talking about this dimension to your life. He said that anybody who got CKD and renal failure 60 years ago, what happened is you died. Now people don't die anymore in that sort of way, because now what we've got is we've got dialysis and we've got renal replacement therapy, so we've got transplants. He said, but that doesn't mean we've cured kidney disease, because we haven't. What we've got are hold-in positions. And I think the thing that we've heard about today, which is really important, and certainly the work that Kidney Research UK do, is funding research which is based at curing kidney disease. And kidney disease at the moment is not cured, although we've got things that can help people cope with it. Anybody else like to raise anything? I mean, it was quite interesting that people were talking about diet earlier. Does anyone like to comment on the pros and cons of diet that they're? Okay, thank you.
Hello. I had quite severe protein loss at some point. I found that a gluten-free diet actually helps, and my protein loss is reduced. I did have other symptoms that suggested I should go gluten-free, but I've found that I've got a lot fewer kidney symptoms since following gluten-free diet.
Anyone else like to raise anything? Yeah, okay. While the microphone's going there, I'll just say that before I had my transplant, I was on a low potassium diet. There were lots of things I couldn't eat, chocolate and tomatoes, and when I had my transplant, my potassium function went back to normal. And my transplant surgeon said, yeah, you can eat high potassium foods now because your kidney can cope with it. And I thought, right, am I going to have a banana? I hadn't had a banana for 6 years. So I went out shopping and bought some bananas, and I came back and I didn't fancy one. Sorry, who's someone towards the back?
Yeah, I'd just like to share that, as probably most people know, the journey isn't smooth. I was diagnosed December 15, and it's been a rocky journey since then. 4 months later, I started peritoneal dialysis, which has worked well. We've been away on holiday with 10 days' notice skiing. We packed a bag, 2 suitcases of manual fluid, cleared it with the airline, went away. And we go camping. We have electric hookup, but it doesn't have to be the end of things you do. You just have to plan ahead. I view, when I was on manual dialysis, you go out for a day. It's like you've got a baby. You've got to pack your bag and go out. Yeah. And but we do try and carry on. Unfortunately, in January, I had a transplant, and I had a blood clot, so it came out 5 days later. And then I had C. diff, so it wasn't nice, but I've got over it. It takes a bit of mental to get your head around it all, but now I'm back on the transplant list, so things can go really wrong, but it takes time. And I've had 2 lots of counselling, so if you need help, I'd recommend seeking help. But our view is it's for life. I've got kidney problems for life. Got to make the best of it. It's changed my life. I have afternoon naps, go to bed, but we maintain quite a good family life. So I'd just like to say, if you do get to dialysis, try and make the best of what you can and do things. That was all.
I mean, you raised an interesting point about it not letting it rule your life, and it's a thing that Margaret said as well, who's had to leave us. That having IgA in actual fact has galvanised her life really, and she does a whole range of things that she wouldn't necessarily have done before. One of which I know full well, because Margaret's a Facebook friend of mine, is that she travels extensively. She's actually never at home, other than when she's playing golf. But I wonder if John's here, if you could comment, John, on what you say to people who come to you who've got CKD, who say, what guidance would you give us about travelling? The places we ought to go to, the places possibly we ought not to go to, and the things we need to think about.
Thank you for that, Phil.
You can get me back for that.
So I don't think there's any specific IgA nephropathy advice. There is advice relating to what your level of kidney function is. Because the closer you get to needing dialysis, the less reserve your kidneys have of dealing with problems. Be that a bit of diarrhea and vomiting, be that the very hot weather and getting dehydrated. So the advice I give is very much related to the level of kidney function, whatever the cause. And the closer you are to needing dialysis, so if your kidney function is in the low teens or in single figures, then we are very clear about offering advice about where are potentially good places and potentially not so good places to visit. So by and large, travelling around the UK is relatively safe. Europe is okay. We have a lot of patients in Leicester who come from the Indian subcontinent, and we do get concerned travelling that far distance about what would happen if someone's kidney function failed in that part of the world where perhaps there isn't as much easy access to dialysis. And I guess in London, again, there are lots of people from lots of different parts of the world where you have to tailor the advice to the countries that they're going to. But there should be no specific IgA advice. It's very much related to the level of kidney function that you have. The other issue from a transplant point of view are the vaccinations that you're allowed or not allowed to have to go visit certain countries. And that's something you do need to think about in terms of live vaccines and killed vaccines. But my advice to patients is that you let me look after and worry about the IgA nephropathy and you go on and do whatever you want to do. Because I think that's the absolute key, is everyone in this room needs to be able to work with their kidney doctor, to understand what's going on, to understand as well as possible what's happening in the future. And when you leave that room is to go and live the rest of your life and let us think about how we handle the kidney disease and work with you to try and make things as good as we possibly can. But the important thing is not to let the IgA nephropathy run your life, not to get obsessed with looking at your blood pressure 3 times a day or dipping your urine every day. We will come up with an idea about how frequently you should measure things, what will be an indicator. And to be honest, most of my patients have my telephone number, my office telephone number. I look at the Facebook pages and I contact patients if they're doing something very silly, privately. But you should have a contact number for someone to ask advice. There is nothing worse than having a 6-month review and thinking of something on month 1 and waiting 5 months to ask the question. We need to have, and this is where Tom's talk came about social media, we need to have a much more receptive way of getting advice quickly to stop the worrying, to give very simple, clear advice so that you can get on and live your life. And that was one of the ideas behind the Facebook page, and one of the ideas of having these days is that you get contacts with people who you can ask. Because there is nothing worse than sitting at home wondering what the right answer is, going on the internet and finding 20 different answers to the same question, 19 of which will be completely wrong, and not knowing which is which.
Thank you. Well, we're going to wind up in a minute because there's coffee out there and hopefully some of those cookies again. But I wondered if there's anybody who's got a burning desire to make a last point or wants to raise anything before we shoot off for coffee. Yes, last point here then. Thank you.
Just the last point as a mum of a patient. Reading the lab reports that come, with the level of creatinine or whatever, it's really hard to understand. And I have tried quite hard to sort of look at the level of where we're at. But in fact, if there was some kind of dictionary which was fairly simple about sort of saying, look, this means this, in terms of the kind of reports that you get from the hospital, that would be really good.
Is the patient that you're with on using Patient View?
No.
Right, because I don't know how many people use Patient View here. Yeah, quite a lot of people do. I do all the time. One of the things I like about Patient View is that I always get very twitchy when it comes up to the time for my blood test. And I see my consultant on a Wednesday. and I do my blood test on a Monday, and then I get all my results on patient view on a Tuesday, so I can read them all before I go and see him. But one of the things on patient view is if you look at anything, potassium level or creatinine or EGFR or whatever, there's a little key on there as well that opens another page with an explanation of what these numbers mean and what normal would be, and if the numbers are not normal, how abnormal those numbers are, so I find that very useful because a lot of the results I haven't got a clue even what they mean. But if you look them up in the key and it opens the page relating to that, it gives you all the information. So
that's fantastic.
So to get onto patient view is I would recommend that for everybody. Actually, it's a great thing.
That's fantastic, and it would be really helpful then if GPs and also consultants could just kind of let people know that where they haven't. I mean, obviously in some cases people have, but.
Last one this time.
Just one thing from me. I mean, sometimes when you get blood tests taken, and then you phone your GP and just say, what's the result? And tell you, yeah, it's normal. Ask them about the numbers, because quite often I ask them, what's my EGFR?
Yeah.
So 53. Ah, okay. So for them it's normal, but for you might have a completely different meaning.
Yeah.
You have to ask them specific sometimes, because quite often GPs, just for them, just don't really get that.
Well, I think that's an absolutely excellent point. And on that point, we will go and indulge in some caffeine, those of us who wish to. So thank you very much indeed. And thank you, you two. That was brilliant.